Hello friends, I don't know how many of us realize that creating the correct size of Capsulorrhexis can play a pretty important and crucial role in how successfully you're able to complete the phacoemulsification, encountering as few problems as possible. The correct size of Capsulorrhexis should be largely dictated by the amount of nuclear sclerosis, so maybe about 5 to 5.25 millimeter Capsulorrhexis is good in a case with a grade 1 or grade 2 nuclear sclerotic cataract, but a slightly higher size of Capsulorrhexis will function well in a patient with a grade 3 or grade 4 nuclear sclerotic cataract, and we need to aim for a 5.5 or 5.75 rhexis in these patients. Now let me show you a case where the rhexis ended up being slightly smaller, just about 5 or less than 5 millimeters. But since this was a grade 2 nuclear sclerotic cataract, I decided to go ahead and complete the phacoemulsification. So the hydrodissection was okay and quite proper, and I was able to get a good cortical cleavage hydrodissection. The problems that you need to bear in mind while performing phaco in a small rhexis is that you may inadvertently nick the anterior capsule while you're creating the direct chop. But if you are aware of the edge of the Capsulorrhexis, and if you are carrying the sharp tip chopper into the substance of the nucleus into the mid-peripheral zone, then this disaster can be averted. The other problem is that you need to just create smaller fragment sizes, because just creating 4 large fragments, you may find it difficult to mobilize them through the small size Capsulorrhexis opening. Because the Capsulorrhexis puts a lid on to the nucleus, and it may be very difficult to move this fragment into the central space. This is what you're seeing in this patient. If the rhexis was slightly larger, then this nucleus piece followability would have been excellent. But the sluggish followability is not because I'm using different parameters in my phaco settings. The phaco settings are identical to what I normally do, but the fact that the rhexis is smaller causes a difficulty in mobilization of nucleus fragments. Now the most important pressure point is this, that you may catch the anterior capsule and create a large zonular dialysis, as I did in this case. This of course does not happen all the time. In this case I was being a little fast and a little reckless. So I created a zonular dialysis superiorly when I was trying to remove the subincisional cortex, because instead of holding on to the cortex, I held on to the anterior capsule. Now how do we proceed from this point? First, evacuate the cortex 180 degrees or diagonally opposite the site of zonular dialysis. Now, the surrounding zonules, of course, are strong and healthy and will not get compromised. In the subincisional area, when I'm trying to remove the cortex, you can see that the capsular bag actually presents itself at that point, and hence it is very, very important that you do not persist in removing the subincisional cortex. Of course, the great lifesaver for all of us is the availability of the capsule tension ring. It is threaded into the capsular bag by a hand-over-hand maneuver and put into the capsular bag. Now what the capsule tension ring does is that it stretches the equator of the capsular bag. It works beautifully when the zonular dialysis is less than 3 clock hours and the surrounding zonules are also strong and healthy. So once the capsule tension ring is in place, then the removal of the superior cortex can be done with impunity without worrying that the capsular bag will follow the phaco tip due to the high vacuum. The intraocular lens is then implanted as an additional safety precaution. I locate the haptics of the lens in the area of the zonular dialysis, hoping that the pressure of the haptic will cause an additional buttress and support to the dialyzed zonular area. So this completes the case. Remember that if you end up with a small size capsulorrhexis, do not persist with phacoemulsification. It always makes a lot of sense to put in some visco, make a small nick and enlarge the rhexis to the desired size so that you can avoid much of the problems associated with small rhexis phaco. Thank you for your attention.